While you might love taking selfies, your body might not. Selfie elbow is the latest physical ailment caused by the overuse of cell phones. It joins a long list of other tech-related injuries like iPad hand and text claw. Doctors say selfie elbow is a kind of tendonitis similar to tennis elbow. Joining us with more is the co-owner of the Sports Specialist Rehab Center in Toronto, Dr. Marco Ciantis. Good of you to be here.
Very nice to meet you.
Thank you. So is this really a medical condition?
It's not a true medical condition, but the signs and symptoms mimic a lot of other medical conditions that are out there, such as tennis elbow or lateral epicondylitis and olecranon bursitis.
So you've got a phone there. Show us the movement that would cause this discomfort.
So it's not the phone that will actually be the problem. The weight of it is negligible, but holding it up like this or twisting your wrist, it's the weird positions or the contorted positions you would put your elbow and wrist in. That would be the main idea that you would actually get this sort of condition. So particularly like this, or holding it like this, or if you got the actual stick and holding it out that way.
So the stick doesn't help?
The stick does not help whatsoever. Keeping that object further away from you causes your wrist and your elbow to act as what we call a fulcrum. So they're stress points. And that just tends to build up over time and over time. So if you look at it, the average millennial will take about 5 hours of selfies per week and 25,000 over their lifetime. So that repetitive strain adds up and builds up and builds up and builds up to a point where you get, ow, that starts to hurt. And then.
So you're actually seeing this, and how are you treating it?
So we treat it pretty much the same way as we do with an actual tennis elbow. So we do a lot of soft tissue release, some ice, some heat therapy as well too. And the big thing is to try to mitigate the mechanism of injury, which is taking those selfies. So if we can try to lower the amount of time and number that they can do in that week, this essentially will be a self-limiting condition. It will take care of itself.
I've had a little bit of this tennis elbow before, and I squeezed the ball and did exercises. Yeah. Do you recommend that to millennials as well if they're taking 5 hours of selfies a week?
I would highly recommend they can try to at least cut that down in half, get some of their friends to take it, or not take so many selfies in a row, but definitely cutting down the time period and doing that work through their hands and through their wrists and their elbows can absolutely help it out.
Okay, what about text claw and BlackBerry thumbs?
So that was pretty prevalent quite a few years ago as well too, and that just comes from
Is it still around, or is that?
It's definitely still around. It's also known as mother's hand or baby thumb, because mothers can get that condition as well too when they're holding their newborns. It's the same sort of mechanism. So it's still around, not as prevalent because BlackBerries aren't as prevalent that much anymore, but it's still around. We're still treating it.
My goodness.
Yeah.
All right, do you at all recommend people just put down their phones?
I highly recommend we try to limit the mechanism of injury. Okay, so that will mean putting down their phones. Obviously, that's not going to be happening in this day of age, but definitely cutting back the amount of time you're holding that phone and holding in those weird positions which can exacerbate those areas. Absolutely.
Okay, Marco, thanks so much.
Thank
really
you so
appreciate
much.
it.
Appreciate it.